impact of, looks like a little bit of the impact of COVID-19 and then diarrheal disease. And so, I know everyone's attention, as we were just saying, is focused very much on the pandemic right now. But I think one of the things to keep in mind is that all the other infectious diseases which we had before the pandemic have not gone away. And, in some ways they've gotten worse. I'm sure we'll hear more about this from Simon. And so, this is something that, we have to continue. All the things we're working on need to continue in addition to the new efforts responding directly to the pandemic. So Simon has a bit of a history with the Diarrhea Innovations Group. He was, in 2017, he began the effort from DIG to get co-packaged ORS and zinc on the WHO essential medicines list. And as some of you know, that application was approved just about a year ago now, last summer in 2019. And so he has continued to work with DIG on trying to get this global level guidance in place at the national level. And so it's great to have him here. And Simon, looking forward to your talk. Over to you.
Okay, well, many thanks, Robert. And I can't see who's on this call because my screen is full of presentation. But when I finish, I'll look forward to switching off my screen and seeing who's participating. But hello to everyone, and thank you for joining this webinar. As Robert has said, my name's Simon Berry, and I'm the CEO and co-founder of Cola Life. Cola Life was established in 2008 to focus specifically on improving access to ORS and zinc for the treatment of diarrhea in children. We ran a trial on co-packaged ORS and zinc in Zambia in 2012, 2013, and we went on to scale up this work nationwide. We left Zambia in 2018, and the ORS and zinc co-pack that we co-designed with caregivers and key stakeholders is now being produced by a local manufacturer for the private sector and for the government. I've split this presentation into 4 sections, and there'll be plenty of time at the end for discussion and questions. The presentation will look at the implications of COVID-19 for DIG's work on co-packaged ORS and zinc, and present some elements of our strategy moving forward. Let's start by considering the impact of COVID-19 on child and maternal health. So far, just over 500,000 people have died from COVID-19 since the start of the pandemic. That's 2 people every minute since we first started recording deaths. So that's 2 people every minute. Yet COVID-19 is not the only disease that kills large numbers of people. Currently, diarrhea kills about 1 child every minute. And this is after many decades of work to bring it down from much higher levels. COVID-19 has been with us for under a year. Diarrhea has been with us since records began. I found it difficult to find data on COVID deaths that was already summarized by age, but I did find this summary from New York City. What is striking about this is the very low death rates in children under 18 years of age and women of reproductive age. Now, I fully understand that this data is from New York City and not a low to middle income country, but the indications are that COVID-19 will have relatively low direct impact on children and women of reproductive age in low to middle income countries as well, just like they have in New York. So all things being equal, COVID deaths in under 5s will be negligible compared with the ongoing diarrhea deaths. Let's look at where we were before the COVID-19 pandemic. Before COVID-19 struck, DIG's focus in terms of diarrhea treatment was on co-packaged ORS and zinc. And as Robert has said, our first success in this area was an application to WHO to change the model essential medicines list to specify ORS and zinc, co-packaged ORS and zinc specifically. This was successful, as I've said, and co-packaged ORS and zinc is now listed in the latest edition of the essential medicines list. Now, evidence suggests that this will literally be a game changer. ORS given together with zinc has been the recommended treatment for diarrhea since 2004, and ORS and zinc have been listed separately on the WHO Essential Medicines list since 2005. So despite these listings, currently less than 10% of diarrhea cases in high burden countries are treated with both ORS and zinc. So listing the two components of the treatment separately on the WHO Essential Medicines list clearly hasn't worked in terms of the uptake of the recommendation. Evidence from Zambia indicates that co-packaging can make all the difference. We gathered stock level data for ORS and zinc from all 30 health centers in Mongu district in Zambia from 2016 and 2017. We then looked at dispensing behavior for diarrhea cases in October 16 and October 17. Historically, October is the peak month for diarrhea in Mongu district. 7 of the 30 health centers had all the diarrhea treatment options in stock throughout the months of October 16 and October 17. In these 7 health centers, 44% of diarrhea cases were given both ORS and zinc. No cases were given co-packaged ORS and zinc in October 16, as the distribution of the co-packaged ORS and zinc products to the public sector had not started at that point. Co-packaged ORS and zinc was then introduced to the public health system in January 17, so in October 17, 3 products were available for the treatment of diarrhea. ORS packaged by itself, zinc packaged by itself, and co-packaged ORS and zinc. In this situation, the percentage of cases receiving ORS and zinc doubled from 44% to 87%. Of those receiving both ORS and zinc in October 17, 87% received it in the form of the co-pack. So the introduction of the co-pack was transformational, even in a situation where already the levels of dispensing of ORS and zinc from separate sources was quite high. So we asked ourselves the question, this is a small group within DIG, could improved access to co-packaged ORS and zinc change the trajectory of global diarrhea deaths? At this point, I'd like to acknowledge the support of Leith Greenslade. We worked together to help answer this question. As we all know, over recent years, very good progress has been made on reducing childhood deaths from diarrhea, although the MDG for child mortality was actually missed. In the new era of the Sustainable Development Goals, the Global Action Plan for the Prevention and Control of Pneumonia and Diarrhea, GAPD, has set a target for diarrhea deaths of no more than 1 per 1,000 live births by 2025. That's the red dot on this graph. As with the SDGs in general, we are on track to miss this target, as indicated by the orange line on this graph. However, the GAPD target could be achieved at global level if at least 74% of children with diarrhea were treated with ORS and zinc, and that's indicated by that green line. This is based on modelling done by Munoz et al. That was published in 2010. At that coverage level, child diarrhea deaths would drop by 112,000 in 2025. When you drill down further and look at specific high burden countries, we can refine our strategy further or our understanding further. In some countries that are struggling with high numbers of child diarrhea deaths, such as India and Indonesia, co-packaged ORS and zinc alone would achieve the GAP-D target, as shown again by the green line. This is the data for Indonesia. Even in countries where this action alone would not be sufficient to meet the GAP-D target, co-packaged ORS and zinc could close a large proportion of the gap between the predicted mortality and the target. Countries such as Nigeria, Ethiopia, Chad, and the DRC are in this category. Once again, the green line shows the impact and contrast with the current trajectory in orange. So our conclusion is that given the low cost of co-packaged ORS and zinc relative to other more expensive, more complex interventions like rotavirus vaccine and the universal provision of clean water, improved coverage of co-packaged ORS and zinc is essential to achieving our child health targets. It offers the most cost-effective strategy to reduce child diarrhea deaths in the next 5 years. So let's have a quick look at how COVID-19 impacts on all of this. As already indicated, the direct impact of COVID-19 on child health is likely to be small. However, it is expected to have a significant indirect impact through the disruption of already fragile health systems in low to middle income countries. The latest figures we have indicate that there are about 45,000 deaths per month from diarrhea. And these are represented by the blue bars in this chart, which I will use to show the impact of small, moderate, or large reductions in ORS and zinc coverage caused by COVID-19. A paper published last month, in May 2020, in The Lancet, modeled 3 COVID-19 scenarios that would disrupt ORS and zinc coverage across 118 low to middle income countries. The key indirect impact of COVID-19 on children will be through the reduced availability and use or the coverage of essential medicines, including ORS and zinc. The Lancet paper used the LiveSave tool, which in turn uses the cumulative evidence linking medicines coverage to mortality. A small decrease in coverage would increase deaths by 8%, and then an additional death toll of 3,640. A moderate decrease would increase deaths by 14%, or more than 6,000 per month. And a large increase, or a decrease in coverage, in other words, a larger disruption, would increase deaths by 36%, or nearly 16,000 additional deaths per month. That's those are global figures. So the evidence suggests that very few children will die directly from COVID-19 itself, but large numbers of children will die from the disruption to the health service caused by COVID-19. Just to put these potential impacts into context, let's look at the potential decrease in deaths that we modeled earlier in this presentation. The green bar takes the reduction in global deaths we expect from the 74% coverage of ORS and zinc and renders that as a monthly reduction of 9,300 fewer deaths per month, or a 21% decrease in deaths. That's what that green line was showing in those earlier graphs. Placing that potential reduction in deaths alongside the potential increase in deaths resulting from the disruption of ORS and zinc coverage enables us to see how devastating COVID-19's indirect impact is likely to be. So what should DIG's strategy be moving forward in the area of co-packaged ORS and zinc? When fragile systems are disrupted, there will be an increased pressure for medicines to be cost effective. This will make advocacy for co-packaging of ORS and zinc even more important. Co-packaged ORS and zinc is the most cost-effective way to deliver the global recommended treatment for diarrhea. As the last column in this table shows, co-packaged ORS and zinc is between 6 and 50% cheaper than the two components of the treatment, ORS and zinc, separately. There will be an even stronger case for co-packaging in COVID disrupted health systems. Looking at things more broadly, the DIG ORS and zinc co-packaging strategy is not yet published, but is likely to be based on this framework, which itself was published in 2016 in the policy document called Progress Over a Decade of Zinc and ORS Scale Up. Before COVID struck, work had already started under the enabling environment pillar of this framework. And this is now being revived. We are working with WHO and UNICEF on a joint statement on co-packaged ORS and zinc, and we've produced support materials for such a statement. This statement should have gone out earlier in the year, but it's obviously not gone out because of COVID. We will then be working through UNICEF country offices to accelerate the uptake at national level of the new global co-packaging recommendation. In practice, this will mean the addition of co-packaged ORS and zinc to national essential medicines list so that they can reflect the updated WHO list. When the DIG strategy is published, we hope that members will consider it when developing their own plans for work in this area. CodaLife, for its part, will be publishing its playbook in September 2020. This is a live online hyperlinked document. The playbook describes our experience of introducing and scaling up co-packaged ORS and zinc in Zambia, and is aimed at others who are working on better access to our ORS and zinc in a particular country or state. Users of the playbook will be able to comment and ask questions within the document itself, and CodaLife will respond by answering specific questions and refining and improving the playbook based on the comments and questions that we receive. Well, thank you very much. I'd like to hand over now to for any comments or questions you might have.